Let's talk about the tourniquet. I made a video quite some time back. I'll see if I can link it for you guys on how to use a tourniquet, how you set it up, and it should be set up to deploy immediately. A lot of people still had it in their plastic packages. I was just shaking my head. Well, I got the tourniquet. I mean, when you apply a tourniquet, you have seconds to put it on somebody. I mean, literally, when an artery is damaged, you will see it squirting like unbelievable out of you. You have seconds to get that stopped. You're not going to live very long while you're squirting out blood like that. And you only got so much blood in you. So you really have to get this on, and that's why you stage it and take it apart quickly and get it on yourself within seconds to stop that blood from squirting. You may get most of it stopped, but you don't release this one. You get the second one and you put it on. That's why people carry two. But there's something to consider about this. They want you to write a date and time on this thing. They want you to, when you put it on, they say after 30 minutes you should release it for 5 minutes so blood gets down to the arm if it's up here. If it's on for 2 hours, then, you know, it starts to kill it. 7 hours, this is dead. So there's limits to your tourniquet. It's not some life-saving device that's going to take care of you like everybody seems to believe. Buy a tourniquet, buy a tourniquet. Consider a scenario. Shit has hit the fan. You decide to put a pack on and you're going to bug out and leave your location and you got no choice. And you start to do so, and one person in your group gets hit and starts squirting blood, and you decide to apply the tourniquet, thinking you just did a good job. When actually you have no doctor in your group, you have no surgical nurse in your group, you have nobody to repair that artery, you have no idea what you're doing, and what have you just done to that person? Because when you put this on, it does not feel good. This is very painful to put on. That person's in a lot of pain. And what did you just do? I mean, you basically gave this person a slow death in a lot of pain because there's no hospitals open, there's no doctors, there's no nothing. You were better off not to put it on and let them bleed out and die. At least they would have died in 5 minutes. It would not have to deal with the pain of this thing. Some people would argue and say, well, at least you gave them a fighting chance. If there's no doctor, if there's no surgical nurse, if nobody knows what they're doing, then that person's dead. And that's all there is to it. I mean, you have to have the equipment. You have to have, hopefully, a sterile room. You have to get in there with some type of micro with glasses to see that artery. You have to stitch that artery. Then you got to release this very slow so you don't blow that artery out again. And when the blood starts going back down to the arm, okay, miracle. But until this slowly comes off and until that artery's fixed, this is nothing but a slow death. And that's the problem. But if you've got a doctor in your group, or you've got a surgical nurse, or you've got somebody that has half a brain on how to fix that artery, and even has practiced. I mean, you can buy things on Amazon that help you practice and hook up different things. I mean, even you not being a doctor, you can practice. I mean, you'd have to get a little bit of equipment and practice and do it over and over, and maybe you'll be at the point where you can sew up an artery. So, if you're going to carry two of these, and you should carry two, and you're planning on having that when SHTF happens or as you bug out, the next skill above this is to be able to stitch that artery. And then to release the tourniquet slowly is to not blow it out again. And that's all there is to it. So, to just say, make sure you got a tourniquet. Make sure you got a tourniquet. No, make sure you got the skills to sew up that artery, to release that tourniquet, so then the rest of it gets blood. Because if it doesn't get blood, then it dies and then you got to amputate. And there's going to be a lot of people getting things amputated that will not make it after being amputated due to infections and everything else. So if your primary idea is to carry a tourniquet, then, like I said, learn to get the skill to heal up that artery, because to stitch up that artery, because nobody's going to ask you what your credentials are or can you do this or anything when it comes to it. Because if there's one person there that says, look, I got some stuff off Amazon and I practice stitching up an artery, and that's the only experience I got. And if you've got this on, are you going to let them give it a shot? Well, of course you are. It's all you got. There's no doctor, no nurse, no nothing. And I'm sure that person will get better with it. I'm sure one or two will die in the process while he's trying to learn, because he learned off some gadgets off Amazon. You can even learn off of, pigs. I mean, you just can't be afraid to get in there and open that up. You need a clamp to pinch off that artery to stop the blood from pounding. So you need a couple different clamps, right? This is common sense. And then you're going to need some type of needle to stitch up that artery. And that's very small stitching. So you're really going to have to practice quite a bit to get it down pat. And not do it once or twice. I mean, you're going to have to, when you do finally figure it out and you're pretty good at it, then you're going to have to do it like every couple of months. Now that's going to make you an asset. Nobody's going to ask you what your credentials are. But if all you have is two of these, and nobody has the skills to stitch up that artery, then all you have is somebody that's in severe pain, that's going to die a very slow death, and you didn't help anybody by putting this on. And that's just the way it is. In today's society, we're very lucky. Now, I carry two of these on me. I carry some in the truck. If I go and put these on anybody or myself, chances are I will be taken by an ambulance. I will be in a hospital to where there is a skilled professional to take this off and cramp down the artery that's bleeding and stitch it up and then remove this. But understand, this is very painful when you put this on. These don't remove pain. If that artery's bleeding here, yes, I got to put that on in seconds. And as soon as I put that on and start twisting, oh my God, the pain is outrageous. You got to be a very strong person just to take this. For the people that don't know that. Because in today's society, they're going to get us to the hospital as quickly as possible, and then we're going to have a professional remove this and stitch up the artery. But not if shit hits the fan, and not if we're bugging out. So it comes down to a hard question. Let's say you get hit, you cover it up, and you're debating for a couple seconds, should I put this on? And you're alone. I don't know. Because once you put this on, the pain is outrageous. Maybe you're better off just to let it go and go to sleep and die. Because if we don't have those emergency facilities, this thing is useless. Now, I gave you a couple options. Like I said, you could learn the skill of stitching up that artery and get used to how small it is and what you have to do and what tools you need. And doing somebody else is easier than doing yourself, because if you do somebody else, then you're not in pain where they are. They're just trying to make it through where you got other people holding them down. But to actually stitch it yourself, I think, would be pretty impossible. So maybe if you're going to carry these and you say, hey, we're all going to have 2 tourniquets on ourselves in our group, then maybe you need 2 or 3 people in your group that actually know how to stitch up an artery. And they all learn that skill in case one is lost. Because without that, this is useless. Catch you guys on the next one.